We were at a big tournament in Atlanta, and it was our first game of the tournament, and we were doing really good. And then I went up to hit a really fast ball. There was nothing unique about that ball at all. I just happened to land weird, and my knee buckled in, and then I heard a popping noise, and it was really scary.
I went out there and I immediately noticed how swollen it was. And of course, my first thought as a parent and a nurse is like worst case scenario. So I thought, oh my gosh, I hope she did not tear her ACL.
I was thinking, what is this? What just happened? I've never heard something like that in my knee before. I was really scared because it was just such an unfamiliar feeling.
When I saw Kate, I diagnosed her with an ACL tear. She had injured her knee playing volleyball. I met with her and her mother, and we had talked about treatment options for her knee injury, including operative and non-operative treatment. If you tear your ACL, you lose stability in the knee. And so therefore, if you're trying to play a sport, cutting, pivoting, and you don't have that ligament, your knee's gonna give out on you, and you can have recurrent pain, recurrent swelling in the knee, and ultimately you're not able to function in the sport that you want to.
When I tore my ACL, I was like, I don't know if sports are right for me anymore. I just can't imagine going through that again.
We jointly agreed on surgery where we would take a part of her patellar tendon and use it to create her new ACL. And we proceeded with that surgery, and she did extremely well post-operatively. Her knee stability was restored. She participated in physical therapy and regained her strength and her confidence back, and ultimately was able to return to sports and excelled and did very well in her recovery.
Whenever she was cleared from the ACL, it was the very end of that volleyball season, the school volleyball season. So she did not get to play. She got to, towards the end, she got to full practice. But what happened next was winter track started. And she had friends on track team, and she'd always wanted to try it. And now she's completely cleared and she's ready to go. And it's available to her and open. The coach was very supportive. So she decided to do that. And she did really well. But she didn't want to give up volleyball, so that's when we went from no sports to 2 sports on top of each other.
I get so much rewardment and excitement when I'm playing sports. In volleyball, when you get that kill and your whole team is supporting you and cheering you on, it's so rewarding. And then in track, when you get that PR, when you get that record, when you win the whole meet, it's just awesome.
We want the patients to get back to doing what they want. Again, whether they're high school athletes or USA collegiate athletes or just weekend warriors, we want them staying active and getting back to the sport that they enjoy, and that's what really keeps us motivated.
USA Health was so comforting throughout the whole experience. When I went into Dr. Clay's office, he told me, this has happened to so many athletes. This isn't some rare case. I know exactly what you need. I know exactly what your recovery needs to be. And he went into my surgery and he got the job done. All the nurses were so nice. I've had very minimal pain in my recovery.